questions about Mucuna and Carbidopa. Olivia is a Parkinson's patient, elegant, studious, and very curious, who always asks me the most complex questions. I try to answer comprehensively.
Doctor, how do the blood-brain barrier and decarboxylase inhibitors affect levodopa treatment in Parkinson's disease?
That's an excellent question, Olivia. The blood-brain barrier is like a tightly controlled gateway. Dopamine itself can't pass through it, so we use levodopa instead. However, if we give levodopa on its own, too much of it can be converted into dopamine outside the brain. That causes side effects, such as nausea, and means less levodopa actually reaches the brain. Decarboxylase inhibitors, like carbidopa or benserazide, block the enzyme that converts levodopa to dopamine in the body's periphery. They don't cross into the brain, so once levodopa reaches your brain cells, it can still convert into dopamine effectively. By using a decarboxylase inhibitor, we reduce peripheral side effects and can use lower doses of levodopa overall, making treatment more efficient and tolerable.
What happens if mucuna is combined with carbidopa in Parkinson's disease?
Mucuna pruriens is a natural source of levodopa. When we add carbidopa, a decarboxylase inhibitor, we further reduce the breakdown of levodopa in the body before it enters the brain. This combination can lead to more levodopa crossing the blood-brain barrier, potentially giving extra symptom relief. However, there is a risk of excessive levodopa levels if we don't dose carefully. Dyskinesia, nausea, tachycardia, and more, as Mucuna products can vary in their levodopa content. In this way, the natural levodopa from Mucuna would have a more effective and lasting action in the brain, and the peaks and valleys caused by its other ingredients would be avoided. Of course, individual responses vary.
I've found that using very low doses of carbidopa, around 8 to 10 milligrams, I can reduce my mucuna to a quarter of the usual amount, and it lasts at least 14 hours. Is that really possible?
It can be. Even at lower doses, carbidopa still blocks peripheral conversion of levodopa. That means more of the mucuna's levodopa crosses into your brain. You end up needing less total mucuna to achieve the same effect, and the benefit can last longer.
I've seen two regimens that achieve the same clinical response: 450 milligrams mucuna levodopa 4 times a day, or 150 milligrams mucuna levodopa 4 times a day plus 8 milligrams carbidopa once a day. Which one is superior?
Both can work, but there are differences in how they balance efficacy and side effects. High-dose mucuna without carbidopa might control your symptoms, but you're at greater risk of peripheral side effects since more levodopa is broken down before reaching the brain. In contrast, using a lower dose of mucuna combined with carbidopa can reduce those side effects because carbidopa prevents the breakdown of levodopa outside the brain. Often, you can achieve the same or better symptom control with a smaller total amount of levodopa.
Does it matter if you take carbidopa first and then mucuna half an hour later, or the other way around? And how long does carbidopa last?
Timing can definitely matter. When you take carbidopa 30 minutes before your levodopa source, whether that's pharmaceutical levodopa or mucuna, you allow carbidopa to start working in the bloodstream, blocking peripheral enzymes straight away. That means more levodopa is preserved to cross into the brain. If you take them together, the overall effect might be slightly less potent. If you're sensitive to side effects or have fluctuating symptoms, that half-hour gap may help. As for duration, carbidopa's half-life is around 2 hours, and its inhibitory effect can last 4 to 6 hours. If you're only taking it once a day, the strongest effect is in the first part of the day.
I've read about green tea potentially increasing mucuna's effects. How does that compare to carbidopa?
Green tea contains a substance called EGCG, which can slightly inhibit enzymes that break down levodopa outside the brain. It also inhibits an enzyme called COMT, which normally breaks down dopamine. Some patients do notice modest improvements when taking Mucuna with green tea. However, it's no match for the potency of carbidopa, which can boost levodopa availability by several times.
Do soya, black pepper, lemon juice, or other natural substances increase the effects of Mucuna in the same way carbidopa does?
These substances can be part of a holistic approach, but none replace the targeted action of carbidopa. Olivia, I hope this helps you see how Mucuna, carbidopa, and these other substances can interact. However, always remember to have a doctor's check and remember that each person's reaction is unique.